I'm Mary Rensel, one of the neurologists here at the Mellen Center. I'm here with a patient, Tracy, who's with me today to discuss some information about complementary alternative medicine. Recently, the American Academy of Neurology has published a review of complementary alternative medicine in relation to treating MS and helping MS symptoms. So we're going to discuss some issues that came up through that review. The review mentions that, number one, the definition of complementary alternative medicine. It's something that's complementing your standard medications that you're taking for your MS and or something alternative that is not discussed daily with your doctors to help your MS symptoms. So we're going to discuss a few examples of complementary alternative medicine. What would you say, Tracy, is an example of complementary alternative medicine that you use in your practice?
I use diet quite a bit in trying to eat as healthy and as organic as possible. I also add in exercise to a great deal and supplementation where I feel my diet might be lacking, and a social network around you is very important, I think, and seeing yourself going in a positive direction and having those people around you that help you stay positive.
That's great. Those are great examples, and we're going to discuss those in more detail in a little bit. In the review, they reviewed a few products and then rated them according to level A, B, C, or U. And A stood for that there was a significant amount of evidence that this may help MS. B meant that there was some evidence that it could help MS. C meant it suggested that it potentially could help MS. And U meant it was just unknown. We were not sure about it. And some of the products that were tested included biofeedback, Ginkgo Biloba, low-fat diet with fish oil supplementation. And some of the findings is that we are not sure exactly the best way to help MS. Most of those things came back that it's not known if they help MS, or it's a low level of certainty if they help MS. This information from this AN review came from looking at all the studies that are out there in the medical literature to see what helps MS. Now the situation there is that some of these studies are small and they were not powered, or they didn't have enough patients in there to show if they definitively helped MS or not. So we're left with the information that we have and to guide the patients accordingly. Now Tracy mentioned diet with MS. One of the studies was that a low-fat diet, that was a study that was done here, so the fat percentage was 10 to 17% fat, and they were supplemented with fish oils. And to see if that helped the MS symptoms or the MRIs. And it turns out when those folks were followed for a year and a half, it did not help the MS in that amount of time, either on the symptoms, quality of life, or the MRI. Now that being said, that was a smaller study, so maybe there was something to that. Maybe you only need a low-fat diet, or you
Right.
don't need the fish oils.
Right.
Or, so there's so many variables in a person's diet. So it's a good idea, and we recommend that patients follow something like a Mediterranean diet. How about you, Tracy? Are you familiar with the Mediterranean diet?
I am, and I think that following a healthy diet, no matter what your circumstance is or what disease you may or may not be dealing with, is always a good thing, and always giving your body as many resources to draw on as possible. So there's no negative to eating a healthy diet.
Right, and it's
for
very,
anyone.
I agree with you. And there's a very, it's an easy diet to follow here. It's, things we can find in our grocery stores. Fresh fruits and vegetables, colorful fresh fruits and vegetables, a little bit of meat, lean
Right.
meats,
Lean.
beans, a lot of fiber, something like, think of a beautiful little island in Italy. What do they eat? Go back a few generations, simple. We don't crack open bags of chips and crackers,
Processed foods.
We don't do the processed food, just the whole food, the real thing. So that's interesting to know, and the reason where we get that is the Mediterranean diet. We borrow that from our cardiologist friends. It's showing that a healthy lifestyle with a good Mediterranean diet decreases inflammation in the body. So that seems to be quite important for general wellness. The other area that Tracy mentioned was exercise. So how many days a week would you say that you do some form of exercise?
5 to 6.
Yeah, it's wonderful. So it's good to do different kinds of exercise. Is
I
that
do.
something that you do?
I do some yoga, I do some Pilates, some spinning, and some weight-bearing exercise,
Right.
some weight training. So,
Right, so that's wonderful. Those are good sources of wellness where you could do the weights, because it's been shown that we start to lose muscle mass even in the 30s, so we want to rebuild that, keep the bones strong. With MS, the bones can get thinner than folks without MS, so lifting the weight stimulates the bones to stay strong, in addition to taking calcium and vitamin D. And then regular exercise program, I always tell people 30 minutes, 3 to 5 times a week of doing something, stretching, mix it up, little weights,
Right,
aerobic,
exactly.
and have some fun, and
Right.
have a buddy. It's usually good to have somebody who knows that you should be there. If you're not there, they check in with you, or you do
Absolutely.
it together. Do you find that?
Yes,
Mhm.
yes. Emotional support, my social network is mostly done is through the wellness center. So it's a fun place to go, be active. You feel good when you leave. You've seen your buddies.
Mhm.
It's just all positive.
And you connected, and
Uh-huh,
that's good
absolutely.
emotional wellness.
Uh-huh.
Because we do know with MS, emotional health is very important. So the more a person's connected into their community in different ways, whether it be with their exercise class, through the church, through volunteering, through work, through school, the more they connect with others, the healthier that we all feel.
Mhm.
That's great. Okay, some things that have come through the review that we're not sure if they help MS. There's different products of marijuana. There is smoking marijuana, there are marijuana pills, and there's a spray into the mouth. Now, most of the studies with those looking at if they helped MS stiffness or MS spasticity or the symptoms of spasticity. The one thing that came out positive is potentially the oral or the spray of the marijuana may help the spasticity symptoms, but it did not help to relax the muscles. Now that you can only use depending on the state where you reside and the state laws. In Ohio, we're limited. We have limited use. With that, we cannot use that for MS symptoms. So I would advise you to check with your state laws and your neurologist that's treating you in your particular district or state where you live. The other information that came up, we've discussed the ginkgo briefly, and ginkgo was tested to see if it would help memory or energy. It didn't seem to help the memory, but it seemed to help the energy a little bit. Some other products that seem to help some of the MS symptoms, magnet therapy. Some people will wear a little bracelet or sleep on something that has some magnets in it. Maybe that could help the paresthesias or the abnormal feelings on the skin. That came up a medium level that could be helpful for some of the MS symptoms. So we have some products that may be useful. The biofeedback is one of the ones that didn't have enough evidence to help MS symptoms, so it needs more data. Probably the moral of the story of this is to work, to raise some funds for research for MS so that we can study these things in more detail and see what exactly helps MS. Because so many of these studies were small studies and they did not give positive results or unknown results. It just wasn't a large enough study to know if it would help a majority of the MS patients. There were not many studies done with vitamins or supplements. Some of them were done, but they were too small to know if they would help. So at this time, we recommend vitamin D. That's a standard therapy for MS. Typically, most folks need 2,000 IU of vitamin D every day. That's not considered complementary because there's so many studies with vitamin D. That's a standard therapy. We do recommend everybody be on a multivitamin just to get a general range of vitamins. Beyond that, we don't have to have you take other supplements. Some people need some B vitamins, to help with energy, but again, that hasn't been proven in the studies, so we need more studies to show that. Your neurologist here at the Mellen Center helps you to know how to treat your MS, correct?
Yes.
With what we would call conventional medicines, correct?
Exactly.
Okay.
And I feel that is probably my most important asset to dealing with my disease is their guidance and the medication. I want to stay on a conventional therapy that has been proven and has had a lot of studies done. And then I add into that a healthy lifestyle, the diet, the exercise, supplements, but I coordinate all of that with my neurologist at the clinic.
That's great. That's great. And that's what's recommended, is that we have many tools in our toolbox to help MS. And we know the conventional medicines, we're getting more and more each year, and we have a lot to choose from, and we have ways to treat the disease of MS. The other finding that's quite important is there are multiple studies showing that lifestyle choices are very important in the long-term rate of disability one can expect from MS. So what Tracy's such a great example of is using diet, healthy diet, exercise regularly to keep the body healthy and to help it to heal. And there's been many studies showing that if a person with MS has hypercholesterol, high blood pressure, obesity, they have more trouble walking and they need a cane 6 years faster than somebody who kept a healthy weight. So it's very important to use all those tools in the toolbox. Use your MS medicines and to use the complementary alternative medicines, as well as regularly moving, healthy diet, to feel as great as you can with the MS. So I'd like to thank you today for coming in and discussing all your successes with us. You're really
Glad to do that.
Great. You're a wonderful example of using complementary alternative medicine and standard therapy to beat this.
I can tell you from my experience that, on diagnosis, it's very devastating. But once you get a social network around yourself, find out some information, and use those things, you'll find that this can be dealt with as a chronic condition, and you can be healthy and you can get through this, and not to just assume that this whole experience will be negative, that there's a lot of positive that comes out of it. My choices I made in my life once I was diagnosed included the diet and the exercise. I did none of those things before. So there's been some positive, and you just need to look in that direction, that you will be okay, and to search out the answers and stay in contact with your doctor, and try and be as healthy as you can.
That's great. I think that's a wonderful message. Well, thank you for your time. And please see our website. It's listed below for more information. We do wellness consults here at the Mellen Center, and we have an integrative holistic medicine program as well here at the Cleveland Clinic for further information.